now let's try to understand like what are the different types of diabetes. Main is the type 1 and the type 2. Let's understand them in detail. So there are two types of diabetes, as you know, type 1 diabetes and type 2 diabetes, right? So here when I talk about the type 1 diabetes, it is an autoimmune condition, right? Type 1 is an autoimmune condition where the immune system attacks the beta cells in the pancreas. So, which leads to the pancreas being unable to produce insulin because the body lacks insulin. And what happens is the glucose is actually unable to enter your body cells, which results in high blood sugar levels, right? This is the cause of the type 1. So the treatment for type 1 involves monitoring your blood sugar level and administering the insulin therapy. Now let's talk about type 2 diabetes. This occurs when the body develops insulin resistance and it cannot use your insulin efficiently, and it causes insulin resistance. It is often related to increased weight, those who show increased blood glucose as a result of insulin resistance. They can also develop pre-diabetes condition where the blood sugar is high but not enough to be classified as the diabetes. But however, unlike type 1 or type 2, diabetes can sometimes be managed even prevented with the lifestyle changes. So now let's try to understand the role of insulin in the body. How does insulin work? Let me explain to you. So here, think of your body as a house and the cells as locked rooms inside, right? So your body is a house and there are different rooms inside your body. Those are your cells, okay? They are locked. So what happens? Glucose, which is nothing but the sugar, is like the food which is waiting outside the rooms, but the doors are locked, right? So what happens here? The insulin would act like a key because it is going to open, it's going to unlock the door which is of your room, right? And the door is going to be acting like a glucose channel, and the food, that is the glucose, can enter the room, that is nothing but your cell, right? So when insulin attaches, this is the insulin, this is the insulin receptor, right? And this is the glucose channel, this is closed. So insulin is going to be the key that is going to unlock the glucose channel, right? So when the insulin is attaching here, the insulin is attaching to the insulin receptor, which is locked on the cell. It signals the cell to open the glucose channel. So you can see here, right? So this is the glucose channel which was closed before, but with the help of insulin, it is now open, right? So the glucose channel opens and the glucose can enter the cell, giving it like the energy, right? So without the insulin, the doors are going to stay locked and glucose remains in the blood. That is something that leads to high blood sugar levels, right? So this is what happens in the diabetic condition because there is insulin resistance or your body is not able to produce much of the insulin hormone. So now let's understand what is this high and low blood sugar levels. Right. So here you can see this is the normal blood glucose. This is a high blood glucose, right? So this is the balanced state on the left hand side that you see. So what happens is here the blood has just the right amount of sugar. So your body can use this sugar for energy and everything that is going to work very smoothly in the condition where on the left hand side. But in the high blood sugar level, this is the part here, too much sugar, there is like literally too much of sugar. You can see the glucose, the yellow particles over here, all of these are the glucose. There is too much of sugar that is being floating around like in the blood, and this happens when the body does not make enough insulin, like what we tried to learn in our previous slide, right? So when your body doesn't make enough of insulin or it cannot use it properly, this is the condition that happens. Too much of sugar in the blood can cause problems like tiredness, thirst, frequent urination, and there could be long-term health issues like heart diseases or nerve damages as well. So these are some of the signs and symptoms, which we'll be learning in our future slides. So yeah, basically the left hand side, the normal blood glucose level, it has right amount of glucose, and over here it has, the glucose is more in your blood because there is not much of insulin, or your body is not able to produce much of insulin. So this is the difference between the normal blood glucose and the high blood glucose levels.